When diabetes attacks kids. Contrary to popular belief, the only older people suffer from chronic diseases such as diabetes. More and more kids are now diagnosed with this illness all over the world. The type of diabetes that kids are prone to is the type 1 diabetes, also known as juvenile diabetes. This type is diagnosed in almost 40 children every day in the United States of America alone. Type 1 diabetes can be considered as the rarest type compared to other diabetes types such as type 2 diabetes and gestational diabetes. But now, more and more people, especially the younger ones, suffer from it. Type 1 diabetes usually occurs in person's body when person's body stopped from producing enough insulin. So when your body stops producing insulin, diabetes type 1 usually occurs, which is a type of hormone that every human needs. In order to survive, people, especially kids with this type of diabetes, should have insulin injected in their bodies every single day in order to continue living. With the help of modern technology, kids with type 1 diabetes can live a normal life because they have better options in terms of blood glucose testing and insulin administration, which are just some of the common processes that diabetes undergo. To help kids cope up with their condition, more and more medical facilities now offer treatments that can help the child live an active, healthy, and a life filled with fun excitement just like other regular kids. Dealing with diabetes in children. Parenting a child is enough challenge for a parent once he or she has decided to form a family. But when a child is diagnosed with a chronic illness such as diabetes, parenting and raising this child become more difficult, challenging, and at times frustrating. To help parents deal with their children when diabetes attacks them at such an early age, experts say that they only one, encourage and help the child to develop healthy eating habits. Once a child is diagnosed with diabetes, it makes his or her world smaller. There will be more restrictions, especially in eating. These restrictions can lead to eating problems that will harder to manage once they get older. So as early as now, parents must instill among their kids the importance of eating healthy and well balanced food to avoid further diabetes complications. 2. Ensure to test blood glucose levels regularly. The ideal frequency of blood glucose testing is at least 4 times per day. If possible, the parents should monitor this themselves to ensure that if the child is coping up with the condition or not. And 3. Instill in the child the importance of regular exercise to avoid being obese that can lead to more complications among kids with diabetes. Parents must make exercise a part of their child's daily living. This exercise should not be so rigorous. It can be a simple walk, jog, or even helping out with household chores as long as there's enough movement for the day. Next, reassure the child of your love and support. There are kids with diabetes who think that having the chronic illness is their fault. Many of them also think that they have that condition because they did something bad or they are not just good enough for their parents. To erase these doubts in the child's mind, parents must always ensure their child that they will support him or her no matter, and they will love the child no matter what. If you are serious about knowing what to do when your child is diagnosed of diabetes, make sure you check out this site right here. This site is helping thousands of people get solution over this problem of diabetes in kids. You can check it out instantly by clicking the link in my video below.